Good afternoon, everybody. This is Gary Pace, Public Health Officer of Lake County, and it's March 4th. We are here to give you the Lake County COVID response update. So at this point, we're doing a lot better in Lake County and in California. We've now surpassed 50,000 total deaths in California since this pandemic started a year ago. So it's been a long year, and we've lost 50,000 people in the state to COVID. The number of cases, the number of deaths is starting to drop fairly significantly now, and we are optimistic that things are going to continue to improve. Nationwide, they're starting to see a slowing down of the decrease in cases and deaths. So we're not sure exactly what that means right now, but in California and in Lake County, things are continuing to improve. We're going to have Sarah talk some about the specific data, and then I'll go into talking about the blueprint and the tier system, what we can expect to open up, and also about the vaccine. So Sarah?
Right. Like Dr. Pace shared, we are continuing to see a decline in new cases identified in the state of California. Yesterday, about 3,400 new cases identified yesterday. And as Dr. Pace said, we've surpassed 50,000 total deaths in the state of California, nearly 53,000 COVID deaths since the pandemic began. Testing is declining statewide. Yesterday, about nearly 120,000 new tests were reported. We've continued to see a declining testing positivity rate. The most recent 14-day average is 2.5%. That has begun to, the decrease has begun to slow a little bit in the last couple of days, but we continue to see that decline. The impact in our healthcare system is reduced as well, with about 5,100 COVID hospitalized patients and about 1,400 people in ICU beds statewide. On Tuesday, the state's tier assignment was announced for Lake County. We remain in the purple tier, which indicates widespread transmission, but our daily case rate, our transmission in the county is declining. So last week we reported about a daily case rate of about 15 per 100,000. And on this past Tuesday, it was 11 per 100,000. And you can see from the map, compared to last week, a handful of counties that were in the purple tier have now moved into the red tier, which indicates substantial transmission, which is less than widespread and allows some reopening in different sectors of our community and in our community. Our testing positivity is down as well to 4.9%. Here is the epi curve. This shows us the number of new cases identified by week among Lake County residents. So this purple bar here, this is what made our tier assignment, our tier determination on Tuesday. For the next week, the week of February 21st, the week beginning February 21st, we've already identified 47 cases. So we expect Lake County will remain in the purple tier on Tuesday when it's announced again, which means we'll be in the purple tier for another couple of weeks. And we've identified one additional COVID death in the last 7 days in Lake County. Want to give you some update on the progress on vaccination among Lake County residents. So about 9,600 residents have received at least one dose of the vaccine. This is about 19% of the adult population. And when this is up about 1,200 people since we reported it a week ago. And about 4,800 residents who have received one dose, about 4,800 residents have received both doses, and this is about 9% of the adult population. And this is up about 1,800 people since we reported it last week. Lastly, just wanted to tell you a little bit more about who has received the vaccine in Lake County. Public health response efforts have targeted several groups, several higher priority groups who are most at risk for infection and severe outcomes, including death due to COVID. One of those groups are older populations. So we've prioritized people 75 years of age and older. And in Lake County, 50% of people over 75 have received at least one dose. And about 40% of people 65 to 74 have received their first dose. Also wanted to report on our vaccine progress by race ethnicity. So in Lake County, and this is as of March 1st, about 16% of white non-Hispanic residents and about 8% of Latino residents have received one dose. It's important to note here that the data system that we use that's provided by the state does not include data from Indian Health Service as well as the VA. So those data are missing from our system, and we know that Tribal Health has had made a great effort and has successfully vaccinated a lot of Native Americans that we don't have represented in this data here. We'll continue to monitor, track, and report these data on a weekly basis. And that's all I have for the update today.
Thank you, Sarah. So I think one of the really important pieces to notice with this is that we've gotten almost 10,000 people done for their first dose now. And of the people 75 and older, half of them have been vaccinated now in the county. So, and there's going to be a lot of people that choose not to get vaccinated, but our goal is really to try to get the most vulnerable people vaccinated, as well as the healthcare and education staff. And so we're really having some success with all that, even though it's frustratingly slow how it's going out. We continue to get all the vaccine that we get into the county is being used pretty much within a week. So there's nothing being stored or saved. It's all moving very quickly. So I wanted to talk a little bit about the blueprint, the reopening process, and then we'll talk about vaccine for the rest of the time. So in terms of the blueprint, there's a lot of changes happening now. We're going to see some different sort of communications coming out from the governor's office about this. And we're basically just continuing to follow the state guidelines as this goes. So once we get the governor's specifics, we'll be able to share that. But you're going to see some kind of things in the news and hear some things about this coming on. One of the things that's going to be changing is they're going to loosen up some of the restrictions around outdoor events. None of these will happen during March, but after April 1st, they're going to tie in some ability for outdoor events like music events or other kinds of outdoor gatherings, professional sports, things like that, they're going to give very specific guidelines about numbers of people and capacity of crowds, but those will be coming in the near future. It'll be tied to the tier system and also to capacity of the venue, but that will be coming forward. They're also going to be coming out with, well, they just have come out in the last little bit about youth sports. And so there's specific guidelines about youth sports that can happen this spring and with spectators that can go to those. And so you can look into the California Department of Public Health website, the CDPH website, to get some of that guidance. There's also going to be some guidance. It won't be coming out this week, but hopefully within the next couple of weeks, about possibilities for graduation, for high school graduation. So keep your eyes peeled for some of those things, and we can, but there is some hope that things are going to loosen up a little more this spring and summer versus where they were last summer. We're still in the purple tier. And really, once we get to where we get the metrics to go into the red tier, we have to be there for 2 weeks. The way this will go is once we get there, that the state will make a determination after we're in it for 2 weeks, and they'll make a determination on a Tuesday. And then the next day, the day after that, was when it can open. And what will be opening then is some capacity for indoor dining and some of the other indoor activities at lower numbers, so up to 25% capacity, mainly indoor dining, but there's some other ones as well. And the other main thing that is going to be able to happen during that is middle schools and high schools can open up. And I think the local schools are pretty much ready to go in terms of their planning. They're just waiting for a green light, but each school district is doing it a little bit differently. So you'll have to check in with them. But we have at least 2 weeks to go because we haven't gotten into that level of case rate yet. The case rate needs to continue to fall before we can get there. So let's talk about the vaccines. The sites are doing between 500 and 800 vaccines a day. This includes first and second doses, and it's 4 days a week. Southern Adventists had been doing some. Sutter's been having some problems getting supply from their corporate level, and Adventist, I think, has been doing some smaller ones, but they're both having trouble with supply as well. So, but we are doing these at the current sites in Lakeport Mondays and Tuesdays, Clear Lake Thursdays and Fridays, and it's going well. And we're probably going to be expanding them because it looks like we're going to be getting more vaccine coming in the coming weeks. The state just added some other people to the priority level that is able to get the vaccine now. So we are completely aligned with the state eligibility criteria at this point. For a while, we were limiting it some so that we could prioritize the more vulnerable people. But as of this last Monday, just 3 days ago, the state kind of took it over, and their guidelines are what we're going by now. So that mainly at this point includes the elder folks, 65 and older, emergency workers, food and ag workers, and education and school staff. They did add some more people to the emergency workers that had not been added previously, and that includes public transit drivers, janitors, and utility workers. There's been a lot of discussion about courtroom staff and public defenders and district attorney, and it looks like the state is not going to allow them at this time. But hopefully in the near future that we're going to get enough vaccine that we're going to be able to expand it out. Starting March 15th, the chronically ill people will be able, from 16 to 64, will be able to get vaccinated. But if you fall in that category, there's certain criteria that are on the state guidelines list, and you're going to need to get your medical provider to get you documentation that you qualify. It doesn't have to say specifically what your qualification is or what your medical condition is, but if your medical provider thinks you qualify under the state guidelines, get a note that says that, and bring that with you after you make the appointment when you come to the site. So, but that all starts March 15th, which is a week from Monday, so about 10 days from now. If you qualify under some of the occupation guidelines, you need to be sure to bring in some kind of proof of your work when you come, so that we can make sure that you qualify when you get in. You're going to need to make an appointment on the website and then come on in, but bring your proof of work and your ID. So I want to talk a little bit about the appointments because there's been a lot of confusion about that and things are moving around a lot, but they seem to be going better this past week, which is a good thing. We were trying to switch to the state site, which is called the My Turn site, and we were hoping to do that next week, but we're still having some technical difficulties. We're still trying to work with the state to work some of these things out. So it looks like it's probably going to be at least another week. So we're going to continue with the current setup, which basically means if you qualify 65 and older, or you're in some of these occupational groups that qualify you, you go to our webpage, Lake County Health Department, you find the links that are open, and you click on it on the day you want to go. And it's going to bring up a page that you need to fill out an application, and it'll give you an appointment. The first appointments and the second appointment links are different. So you have to be sure to get on the first appointment link, and then you sign up. And when you come in, bring your ID and whatever proof of documentation that you qualify. If the appointments are all full for that link, go to the next day that's available. If you can't get one on any of the links that are on there, we will be opening more links in a couple days. what the deal is that we only are getting vaccine a week at a time. We only know how much we're getting for a week at a time. So we have to kind of do all this calculation to make sure we have enough for the people that are already set up and for the people that are getting their second doses. And then we will open up the other appointments. So it's basically just we're going along a week at a time now, or a couple days at a time, depending on how much vaccine we get, because we don't want to overbook people. So you just have to be patient and keep trying to get on it. Now, if you're somebody who doesn't have internet access or doesn't have the way to navigate through the online platform, there are some phone numbers you can call. You can call the Mohawk line, which is 263-8174, or you can email us at mohawk@lakecountyca.gov. Mohawk is MHOAC. All this is on our webpage. If you're a senior and you don't have internet access or you don't have a way to make the online appointment, you can call 963-4644 and some folks there will help you. If you can't get through, leave a message. If that doesn't work, call us at the Mohawk line and we'll get your name down and get those folks to call you back and help you get on. If there are no appointments on the online site, if they're all taken, calling isn't going to help because we don't have any extra appointments. We just put up the appointments and then kind of get people in until they're filled up. Now, the farm workers are also somebody that's a priority now, and we do have a line you can call. So the Lake County Office of Education, Anna Santana and Angela are there helping people, and especially on Friday, they have people on the phones all day Friday to help with us, but other days of the week as well. And that's 262-4162 or 262-4153 or 262-4159. And those folks are bilingual and can help some of the farm workers get their appointments. So the other part of this is the second doses. If you are scheduled for your second dose, we've had some problems getting all this coordinated because we've moved the sites and we've moved the days. But if you got the Moderna, it's 4 weeks later is when you should be getting your second dose. You can go all the way up to 6 weeks after the first dose without any problem at all. But we do have links on the webpage as well. So if you're due for your second dose, go on the webpage, click on the link and make your appointment there. If you don't have any luck doing that, you can call us at the Mohawk line or email us because we will get you on. We want to get you in. But you don't need to be nervous because 4 weeks to 6 weeks is plenty of time. There's no problem there. So the other thing is the Johnson & Johnson vaccine has just been approved, and it looks like we're going to get some in California here in the near future. We're hoping to get some next week, and the advantage of the Johnson & Johnson vaccine is there's only one dose. The thinking is the Johnson & Johnson, Moderna, and the Pfizer are all equally effective, and they seem to be all good. So we're basically encouraging people, whichever one is the one that you get offered is the one to go ahead and get. Don't wait around. But the advantage of the Johnson & Johnson is that it's only one dose, so you don't have to come back for a second dose. So it's particularly good for people that might be leaving the area or that are very migratory and may not be around in a month or may not be able to be contacted. It looks like we're planning on next Thursday, which would be the 11th, will be a day that we are going to be giving Johnson & Johnson only at the site. So if that's something that seems particularly suited to you or some people you work with or something, try to sign up for next Thursday. So all in all, we're making progress. Things are looking better, and we are now at about almost 20% of the adult population in the county has been vaccinated, and it looks like the amount of vaccine coming in is going to be consistent or maybe a little bit more each week. And we have these sites set up now that are working reasonably well. And so I think we're just going to be able to keep cranking this vaccine out in the coming weeks and trying to get more and more people taken care of. We're really excited to see that 50% of the 75 and older group has been vaccinated in the county, and all the people in the nursing homes have been vaccinated. So I think we're in a lot better shape for if there does happen to be a surge, or if this variants do start taking off, that the most vulnerable people do have some better protection now. We want to get it out more and further to all the other communities, especially the most vulnerable communities, as soon as we can. We're hoping to get into the red tier within the next couple of weeks. We still have too many cases. We're still doing all the same things, the testing, the contact tracing, the isolation, quarantine that's worked before. And so we just want to encourage people to continue wearing your mask, continue doing the distancing, and avoiding social gatherings out in the community with people outside of your family. But get vaccinated, take precautions, and hopefully the cases will continue to drop, and we'll be able to get in the red tier and get all the schools open and get some of these businesses open soon. So thank you all for your patience and your cooperation.